though she has a vested interest in remote and regional areas as well, in particular around access. So thank you so much for joining us today, Kerry.
Thank you so much for having me.
What is the significance of Breast Cancer Awareness Month?
I guess, we know that there's 57 women every day diagnosed with breast cancer. So I guess it's an opportunity for organisations such as McGrath Foundation to really raise awareness that it is a significant impact on people's lives and the health districts and the health services and the community. So just making sure that people are aware that that it is a large number of people that get breast cancer and they need a lot of support, and we need a lot of health services to support them as well.
And there's been some really interesting developments with the McGrath Foundation. There's been quite a lot of funding promised in the last few years. How has that positively influenced in what you're able to deliver?
So McGrath Foundation had a mission of employing 250 McGrath Breast Care Nurses by 2025. We've only got a couple of months left of 2024, and then we are very positive that by 2025 we will have 250 McGrath Breast Care Nurses on the ground. There's a large proportion of these nurses that are living and working within regional and rural areas, so making sure that everyone has breast cancer has access to a breast care nurse.
How does someone become a breast care nurse?
Sure. So it's quite involved. So I was a registered nurse before I went into my breast cancer training. So we do ask that the nurses are registered nurses, and we like them to have 5 to 6 years post-registration experience either within surgery or the clinical oncology space. We also find that working within community health is also an advantage, just so that you have an understanding of supportive care needs. And then there's university or tertiary education that's required, and that can start at the graduate certificate level and go right up to masters.
Fantastic. And from a day-to-day operations, what's the involvement of a breast care nurse with someone who's received a diagnosis of breast cancer?
We really strive to get people into the service as soon as possible after they've heard the words that they have breast cancer, because we find that, easy and early access makes a really big difference to creating a little bit of calm in a time of chaos for people's lives. They have a lot of questions and a lot of implications of a cancer diagnosis to consider in their lives and their families' lives. So what a breast care nurse does is different every day, and it really is dependent on where they're located and whether they're in a metro service versus a regional service. Myself, I live and work within a regional area, so for me it's very much about capturing the patient when they have had an early breast cancer when they've had a breast cancer diagnosis, setting them up for what the next couple of weeks is going to look like, what appointments they're going to have, who they're going to see, and the planning phases around that and what their treatments may or may not look like. This really helps to set people up for their expectations as what's going to happen, takes a lot of the unknown and the crises, feeling of crises and chaos in that time.
It is really an insidious disease that knows no boundaries whatsoever.
Absolutely not.
What led you to specialising particularly in breast cancer nursing?
Look, without going into too much detail, I had a lot of breast cancer within my family history, so it's been a big part of my life for a very long time, for as long as I can remember, really. And it was during a maternity leave for me. A very close friend of mine was diagnosed with breast cancer, and she was telling me about the support of a breast care nurse. And I said, "What's a breast care nurse?" I'd never heard of such a thing. And she told me, and I said, "That sounds like something that I could do." That was 24 years ago. So the rest is history. I did my training while I was on maternity leave. I got a first position when I returned from maternity leave, thought, oh, yeah, this is okay. And, gone on and done my master's and had a brilliant career, I think, in creating a little bit of a cancer network of really supportive care for people with breast cancer.
Yeah, that's
Yeah.
fantastic insights. Thank you for that. And I think just to further expand upon what you just said, there's a brilliant quote by Jay McGrath on the website that is all around receiving report. If I could quote her, it is, my breast cancer nurse allowed me to be Jay McGrath, the friend, the mother, and the wife, not just the breast cancer patient. She, the nurse, was someone that could provide both Glenn and I informed, sensible answers to many questions that we had during our often complicated and confusing treatment process.
Yeah, and I think that people get lost in the system because we get so focused on, treating the disease or the illness without. Sometimes we can forget that there's actually a person and a family around that cancer diagnosis. So I think a big part of my role, I guess, is looking after the person while they are having the treatment that's going to give them the best outcomes. So, it's not so much treatment focused, it's care focused, and care during those different stages of treatment, and also creating expectations about what's going to happen. I had a person saying to me that once they knew what they had to do, they knew they could do it. And that I was able to answer questions. I was able to give them answers before they even knew they had the questions. So I think it's just about, creating that little bit of comfort and peace of mind that there's nothing ahead of them that they can't do.
Really, that person-centered care. I really like that.
Absolutely. Yeah.
That's beautiful. And you did touch on a couple of times then around treatment in particular. How has that changed in your career, treatment and
Oh,
diagnoses?
gosh. So when I first started breast cancer nursing, there was a model of care that existed around the first 12 weeks of a person's diagnosis. Now we have a model of care that goes on for years and years and years, and even looks after people that have a diagnosis of advanced disease. So that's looking after people when their disease stops being curable but is treatable. So we have taken into consideration men getting breast cancer, the fact that some treatments go on for 18 months, the care of people around when they're young and they're going into menopause, or trying to preserve fertility, managing the side effects and the best that we can so that they don't have these latent or long-term side effects. It's incredibly different from what it was 22 years ago. And I'm really proud to say that the McGrath Foundation model of care has kept up with current treatments. So what we, prescribed for the care that's been given really matches current treatments.
And you also mentioned some of the answering some of the questions that people had before they even knew that they had them. What
Yeah.
is some advice you would give to someone who's received a diagnosis of breast cancer? What's some of the general advice you may offer
The
someone?
general advice, one, find a breast care nurse. Very, very easy to do. Go onto the McGrath website, www.mcgrathfoundation.com.au. There is a tab there that says find a nurse, and they just pop your postcode in, and your closest nurse will pop up. You can make direct contact to them. You don't need a referral. The other advice I would give to people is this is your own story. And there are lots of people that are in the community that are very happy to tell you about their great, second cousin twice removed that had breast cancer and their outcomes and their terrible experience. Breast cancer is a very complicated disease, and there are many different subtypes of breast cancer. It's not, there's a lot of subtypes of cancer that comes with a general breast cancer diagnosis. So the treatment implications and the diagnosis is different for everyone. So create your own story, use your own, diagnosis to figure out how that's going to work for you. Block out the white noise of the community. I guess continue to surround yourself with people that are helpful, for you.
Mm.
Use apps such as Gather My Crew so that you can create rosters for people that are wanting to help but don't know how. Looking after yourself, so protecting your information and your news. There's lots of people that will sort of come in with lots of questions, and a lot of the time people will not know the answers straight away. It's a time of great uncertainty, and the processes of diagnosis and pathology can all be, weeks in the waiting. So protecting yourself during those times is really important.
Really like what you said there, trying to knock out any sort of potential bias that people have when discussing it with you or wanting to know things they don't necessarily need to know, and just
No,
maintaining your own
no.
well-being, I think.
Yeah,
Yeah.
absolutely. Yeah.
And I want to ask you a more general question, not breast cancer specific. You've had a long career
Yeah.
in nursing, and burnout rates are through the roof. If I give you some stats, in 2022, 78% of nurses felt that they were burning out, and 28% of people were actively trying to leave
Yeah.
the industries in the next 2 to 5 years. So, how have you had such longevity, and what have you done to maintain yourself in a field that is confronting and is challenging?
I can't answer for everyone. I can only answer for my own longevity. One is I've fallen into a job that I really enjoy, and I also work with people who I respect immensely. I also feel like I get a lot of motivation and inspiration from the people that I work with. And I guess dealing with cancer, people with cancer who have had their mortality threatened, and sometimes, that they're not always great outcomes, that you learn to live in a better way. So that is making sure that you're not sweating the small stuff, embracing those who love you and embrace them right back, doing things for myself that make me feel good. So for me, that is I spend time with my children and my dogs. I go out into nature and walk or sometimes run, and I go to the gym every day. And the gym for me is like my church. It is where the people that I love the most are there. And for those, hour a day, I don't have to worry about anything else but breathing. So yeah, that's for
Mm,
me. That's what's worked. Um, I will say that nursing is really tough, and I can understand why the burnout rates are so high, and by their very nature, nurses are nurturers. And so you spend so much time and effort caring for other people, and if you feel like that care and nurturing is not being reciprocated, then sometimes it's best to walk away. I guess also my mortgage is my motivator. That's completely honest. Yeah.
uh, I really like that answer, Kerry. I can sympathise you with the mortgage. That is an insufferable thing.
It's a
Uh,
reality.
yeah, yeah. I think what you said about mortality, and then not sweating the small stuff and prioritizing things that are actually important to you. And I've only been nursing for 9 years, but I can certainly advocate self-care, but in a selfless kind of way, doing things that make you, going out in nature, things that connect you to your true self. So I really like that response, and hopefully I'll have I'll still be nursing when I'm hopefully I can hit nursing numbers like you have. That'd be
Yeah.
great.
Thank you. Look, I just think that I've been very lucky to be a nurse. Some of my best friends I have met because of my job. I feel very lucky, and I know that that's an overused word, but the harder I've worked, the luckier I've got as well. I've also been quite, and I don't, nurses are not very good at blowing their own trumpet, but I also trumpet, not Trump. I'm also very glad that I took opportunities when they presented themselves. So and even when it didn't feel comfortable a lot of the time, nurses are quite risk averse. And so, it would have been easier for me to not drive a great distance to put myself out into a breast care nurse job. It would have been easier to stay local and and do that. But I thought, no, I could see a bigger picture, that it was going to lead to other opportunities. So I just want to say to people, if they get given an opportunity and it is an opportunity to branch out into something else, and then just take it. I've always been a believer of suck it and see whether it works for you.
What do you see? What excites you about the future of breast care
Uh,
treatment and care?
What excites me, I think that we are really heading to a place where I don't think we will ever stop breast cancer from occurring. I don't know, not in my lifetime. I don't think that there will ever be a prevention, but I think that there will be, I think that we are on the right track for keeping people alive a lot longer, and that quality of life is extended. So we know even now, though, with people with advanced disease, the living well time is about 7 to 8 years post a diagnosis of advanced disease. And 20 odd years ago, when I started my breast cancer nursing life, that was unheard of. So I think that we are, I don't want to say on the cusp, but we are in the right direction in being able to treat people and that they can live well with a cancer diagnosis and
Do you have any
beyond a cancer diagnosis.
Do you have any final messages for our listeners who may have breast cancer or may know someone who is going for a breast cancer diagnosis and treatment?
If you haven't got a breast care nurse, please use the instructions that I presented before. Go onto the McGrath website, McGrath Foundation, www.mcgrathfoundation.com.au, find a nurse. It will make your life easier. And I think that please don't underestimate the toll that having breast cancer diagnosis or the treatments can take on you physically and mentally. And you don't have to do it alone. A breast cancer nurse won't cure your cancer, but they will make it all a lot easier.
Thank you so much for joining us today, Kerry.
Yeah, thank you. Thanks for your support.